education and training through pipeline programs, work-based learning, and continued professional development. Next slide, please. So what we've done to date, we started this work back in December, actually, getting human-centered design training done. And then we conducted empathy interviews January through March with 21 different organizations. We've consolidated our empathy interview findings, and we contracted an equity consultant to review the findings with us and provide suggestions for focus group content, which we then conducted in May. We did 2 focus groups with 4 different breakout sessions hosted at our HIPC and SNCC meetings in May. And then we've integrated those findings, and we're working on completing our health workforce landscape report, which I think we'll be able to release that by the end of this week. So excited to share that with you all. And we're assembling our Health Workforce Council, which is happening right now in the moment. So super excited about our timeline and where we're moving forward. Next slide, please. So this is just a recap of what our goals were for this listening tour. It was to build connections with healthcare employers and pipeline training programs in Santa Cruz County. We wanted to better understand the current state of healthcare workforce, assess which organizations would want to participate in this work with us and who would be champions for our workforce tracks, and to identify participants to join us. So you're all here today because you were identified as somebody who would be interested in this work, or you self-identified, and we're just thrilled to have you guys here with us. Next slide, please. This is just everybody who participated, all the organizations that joined us in our listening tour. So just a huge thank you to everyone who participated. You can go to the next slide, and we'll share these slides with everybody after the meeting, so you'll have time to go back and review them. So our key findings, again, using our human-centered design approach with our empathy interviews, we were focused on these 4 components: identifying challenges and needs, resources and solutions, healthcare workforce, Health Workforce Council priorities, and workforce tracks. And you can go to the next slide. I'm going to go through these fairly quickly just for the sake of time. So we identified many challenges. I'm not going to go through all of these, but just main challenges were in recruiting, cost of living, COVID-19, lack of training programs or impacted programs in the area, work-based learning needs for institutionalized paid work-based learning opportunities, and funding, lack of funding and challenges funding for staff and training programs. Next slide. Also, what we heard as a challenge was equitable and inclusive hiring. There's difficulty hiring bilingual and culturally diverse workers, and wanting a workforce that reflects the community. And not all programs were built to have a workforce, either training or staff that reflect the community. Next slide. So a lot of solutions were also offered up during our listening tour. A lot of those were around reviving recruiting practices, upskilling staff, providing flexible and alternative work options for staff and students, committing to work-based learning and providing opportunities to mentor students, institutionalizing some of these systems and partnerships between employers and educational partners, finding a way to map healthcare careers across the county and share that information with the community. Next slide, please. And also providing earlier outreach to students through pipeline programs, specifically with high school students, restructuring and providing alternative types of training that would meet the community needs. For example, providing childcare or free food to students, offering classes at different hours of the day that could avoid traffic, for example, building more capacity in healthcare training programs, utilizing funding, finding more state and federal funding for our healthcare workforce, building in equitable and inclusive practices into the recruitment and retention of healthcare workforce, and doing more community outreach so that the entire community is really educated about healthcare workforce and career opportunities in our county. Next slide. As we put together the Health Workforce Council, there were lots of considerations for this council, things that they are hoping our council will do, which is focusing on measurable action-oriented objectives, being transparent and clear about healthcare pathways and work on pathways that are not competing for support, having all of our members, that's all of you on this call today, engaged in serving the community, collaborating with educational partners and training partners, really investing in training local residents as an effective capacity building model, and setting best practices for recruiting and standardizations for job classifications. Next slide, please. Also, being informed by healthcare data and bringing in professional experts to consult us when needed. Having this workforce council be a neutral convener that creates opportunities for conversations and that can address multiple issues. Also supporting, having this workforce council represent the community served and support first-generation students and model equitable due diligence when we think about social determinants of health and whole person care. Next slide, please. So these are the recommended health workforce tracks that we are putting together for this council. We have 3 that we're launching today, which is community health workers, medical assistants, and behavioral health and health social workers. The other 3 tracks, nursing, physicians, pediatricians, and clinicians, and the technician track, we're still working to identify champions for those tracks. So if you're interested or you know somebody who you think would be an excellent champion, please reach out to me. Again, that's for nursing, physician, pediatrician, clinician, and technician tracks. And we're working to get those set up before our next quarterly meeting, which would be in September. So moving on to the next slide. The delay is maybe in my computer. Okay, so what does it mean to be in a workforce track work group? For example, if you're interested in community health workers, you're going to have an opportunity to meet with Adrian today in our breakout rooms and join that work group. So what that is, or what we're asking of our participants, is to attend our quarterly Health Workforce Council meetings. That'll be our large group meetings where we can address all the tracks. And those will be June, September, December, and March. Participate in a minimum of 1 work group. So you don't have to do all 6 work groups. Nobody would even have the bandwidth to do that except for maybe me. And that would be bi-weekly or monthly meetings. It might be a bi-monthly meeting. Each work group is going to have its own cadence based on the champion and the participants and what works for them. Following up on any action items from the work groups as appropriate. And of course, HIP will provide logistical support for meetings and work group projects as appropriate. And so I'm here for you guys to help support all this work, our champions and our quarterly meetings and our work group meetings. Next slide. So what does a work group do? So I'm going to have Laura Marcus and Kim Bartley do a very brief presentation. They have about 5 to 10 minutes to share kind of examples of what a work group could look like. Because we've already launched some work in healthcare workforce in Santa Cruz County since the beginning of our listening tour. And so I want to have them share with you what's happening. So you can go to the next slide, and Laura, I think you're up next.
Thank you so much. I'm so happy to be part of this group. And yes, as Haley said, I'm just going to give you a little bit of background. I'll be brief. I know that we're running a little bit over time. But over the years, Dianthus has partnered with the Cabrillo Hygiene Program and the ROP program locally to host interns to give students an opportunity to learn while on the job and experience direct patient care as they go through their training. And of course, also hopefully forge an interest in public health. We've also created our own internal workforce development program, which provides $10,000 scholarships for registered dental assistants to get their extended function license. This is a mid-level provider with a base pay of about $80,000 at full time. And we've graduated 8 extended function RDAs from the program since we launched in 2014. We are starting an AEGD residency program with NYU Langone that starts later this month with 2 residents that will be providing care at our Commercial Way site. So we've done a little bit of this work, but it has primarily been focused on providers. Yet our biggest need, the highest demand in terms of recruiting new staff, is for dental assistants and front office, but particularly trained and licensed dental assistants. So we were invited to participate in the HIP listening tour, and I told Haley about the approach we've taken with our providers and developing pipelines and promoting from within. But you know, our dental assistants are lower paid workers. And they are our largest work group. About 90% of our dental assistants are from our local community. They're primarily young Latina women, many of them new mothers or soon starting a family. The great benefit of that is that they offer lived experience in their care for our patients, and many of them really love the work that we do. But they do, some of them often find challenges balancing a full-time job with their family demands. So while we have about a 14% turnover rate overall, in this group, it's closer to 25%. So we've been seeking ways to retain this group. We recently bumped up our minimum pay for dental assistants to $24 an hour, but we realized we really need to grow our own. So, and especially because Dianthus will be opening a new clinic on Capitola Road in the fall. And we have a need for 15 new dental assistants for just that location, plus an additional 10 for 2 other sites we plan to open in the next 12 to 18 months. And so the need for this new staff plus replacing staff due to attrition makes a focus on this workforce pipeline really important. So I'm sorry to give you all that context, but I feel like it's important. So we didn't have a work group per se, but as a result of the discussions with Haley and then further discussions with Peter and Andy, we were introduced to the idea of a registered apprenticeship program. And just as an FYI, dental assistance training costs about $6,000 and 15 to 18 months to get through. It's typically offered at night. Many of the students are working full-time while they get their certification. And even though jobs are plentiful and sometimes paid well, they're not necessarily all full-time or benefited. And there's very little room for growth in those positions at most dental offices. So on the contrary, in a registered apprenticeship program, candidates can be recruited straight out of high school. They can start on-the-job training 4 days a week in a clinic or an office, a dental office, with 1 day a week of didactic learning. Recruits are actually paid to work and given benefits. And then after their licensure, which, like I said, takes about 15 to 18 months, they become eligible to be hired as a regular full-time employee. And at our organization, that minimum wage is $24 an hour. So we consider that a living wage in our community. The education's free, and $10,000 of the cost to employ these apprentices can be covered by state grants. So at the end, you know, we have help to pay for the program. We have help to support the program. We can do our own training up internally of these assistants. They can learn to do things our way. And then in the addition, there's further opportunities for growth for that population because we are growing and we have need for supervisor positions as well as like the extended function program I mentioned earlier. So all this to say that, you know, there was this need for kind of exploring what the need is, networking with other parties that could help and help us potentially shape a program. That networking led us to meet Nanette, who's on the Zoom meeting today. And we started discussing with Foothill College, who is the only registered apprenticeship program in the state doing dental assisting training. And we really were excited, and we thought, okay, this is it. We need to start working with Foothill College right away and get this apprenticeship program going before this fall, so we have enough recruits to open our new site. We despite all of the plans, we decided that it was really too quick for us to make our way forward so quickly in like I said, preparing for the fall. So we decided that we needed more time ultimately to prepare for the program, both to recruit, because we really wanted to get into high schools with the right, marketing materials and information, and be able to do presentations and things for students. And then also we needed internal programs set up, people that can supervise and train the registered apprentices. And then of course, application for funding and things like that. So although we were ready to go and like wanting to get this off the ground very, very quickly, we were looking at like a 90-day timeline. We decided that it would be better to hold off. And we intend to start this program next spring. And we do feel that, none of this would have been possible really without the support of Haley, Andy, and Peter and Annette, and on and on and on, basically this network of people that came together to very quickly to try to help us get this off the ground. And while we, like I said, are delaying for 12 months, we really are excited and are confident that getting a program like this off the ground locally is now something that is being talked about with the County Office of Education for Watsonville Adult School, potentially ROP. And it's possible we'll be able to open our own local registered apprenticeship program instead of go through Foothill in the future. So more to come on that. And I'm really, eager to see what the rest of the work groups will do. And I'm happy to provide any feedback or support or advice if you have any questions.
Thank you, Laura. So for the sake of time, we're going to keep our agenda moving, but hopefully that's a really inspiring story for people to hear, to wrap your brains around like what a work group could accomplish. It's a perfect example. So next, Kim with Hospice of Santa Cruz County, I'm going to let you share quickly what came out of the listening tour.
Absolutely, I'll be very quick. So hospice aides are a key member of our interdisciplinary team at Hospice of Santa Cruz County. And per CMS guidelines, they're required to have both their CNA and HHA certifications. What we identified was we had a critical staffing need for hospice aides, and there was a real lack of people in our community that had their HHA certifications. And we were noticing that many people had their CNAs, but not their HHAs. And there weren't any local programs, very few local programs that we could send people to. And so with that, and speaking with Haley, she connected us with Watsonville Adult Education and the CNA program director. And from my conversation with them, we learned that, the barrier that they had in providing that training was an RN instructor. And that felt like something that we could help partner with them on. And I had several RNs in mind that would love to provide hospice aid certification training. So we've been in contact with our nurses, and they're currently in process of identifying which nurses that they can partner with to offer a training in the fall and spring. And they will create the program, submit it to CDPH for approval. And our hope is that will really create a pipeline of trained home health aides in our community, and really help provide a career path into healthcare, into home health, because we also have scholarships specifically for our hospice aides to move into nursing. So really sort of creating that growth from the beginning, more entry level into nursing is our goal. And I would say 95% of our hospice aides are all Spanish speaking. So That is it.
Thank you, Kim.
No
Thank you. Great. Well, go ahead to the next slide. So hopefully those two examples give you guys an idea of kind of what could come out of a work group, and we hope that you'll participate in one. So what we're going to do now is we're going to have 3 breakout rooms available with our champions. And our champions are Holly Hughes, Chief Program Officer with Janice of Santa Cruz, is champion our behavioral health and health social work breakout room. Adrian Saxton with Cabrillo College is championing the community health workers work group. And Ashlyn James, Program and Department Chair with medical assisting at Cabrillo College, is championing our medical assisting work group. So you guys should have an option to go into a breakout room. There's 3 breakout rooms with